Hi guys, thanks for tuning in to Beyond the Graphs, hair transplant podcast by Dr. Mark Tam. I am Dr. Mark Tam. Join me today, we've got our special guest, Dr. Clare Tong, GP, with years of experience in treating patients with hair loss and also in her GP practice. So welcome, Clare.
Hello, Mark. Thank you so much for inviting me here today.
Most welcome.
Yeah.
Can I add a special sound effect now? So welcome in here, Clare. So let's do a little intro for our listener to our podcast.
Yes.
Please.
All right. So I'm Dr. Clare Tong. I'm a GP. So I've been a GP for over 13 years now, and I work in the NHS. And more recently, I also now as a private GP, and I also have my own online GP service.
Cool. Online GP service. Cool. So do people come to you and say, I'm receding or I'm losing hair? Do you get some of those patients?
Absolutely. Concerns about hair. It's a really common presentation in general practice. We see men, female, as well as children as well, actually, who come in with hair loss. And it is our job to find out what the cause is for their hair loss. It's a very interesting way. We would take a good history from them. Certainly really important, of course. We would like to examine them, maybe do some tests, find out what medications they're on. And there are so many causes for hair loss.
So nowadays, with hair loss, with so much education online, so much resource, do people look up a little before they come and see you with the hair loss, or do they do? At least for myself, I have a portion of patient who would self-medicate or figure out, well, this is this diagnosis. What would your advice for them?
Yeah, right. Yeah, so absolutely. There's so much online nowadays on hair loss, and I think there may be a tendency for one to self-medicate, to look up things that can help themselves. In particular, perhaps it's difficult to find, to get a GP appointment.
I know it's not easy.
It's not easy nowadays. But my advice is that it is really important, I would say, to see a medical professional, go speak to your GP about your concern, because there are just so many reasons for hair loss, and it may not be the something that you've thought about, and we can certainly guide you as to what the reason might be, and it might be something that we can treat fairly easily. So, for example, I mean, as I said, we do see a lot of people coming in with hair loss, and I would say the most common cause would be androgenic alopecia or male pattern baldness, male pattern hair loss or female pattern hair loss, which I believe is a biggest proportion of patients who come to you for hair transplant. I mean, the reason for that, for example, would be most of it is hereditary. So if you know you have family members who have this type of pattern of hair loss, then you are slightly more at risk of having this hair loss. However, it can also be due to other hormonal imbalances, especially in females. So, we would also then can advise people and consider, for example, conditions such as polycystic ovarian syndrome, and also perhaps in later stage in life, in the perimenopause or the menopause stage. And all of this is something that we can work with patients and to find the cause and perhaps treatment for that. So it's really important to see your GP when you have or concerns about hair loss. Because there are so many reasons, especially other deficiencies, perhaps a skin problem.
Do you do testing for these conditions or maybe exclude some of these conditions? Some testing might be required?
Yeah, absolutely. Yeah. So one common reason for hair loss would be, for example, iron deficiency. So if one has slightly low iron, if you had a low vitamin D level, or thyroid disease, I mean, all of this can contribute to hair loss. So I generally, if I see a patient with hair loss, these are some of the baseline blood tests, for example, I would recommend them to do to exclude some of these reasons. And if there was, and then we would check the skin.
With iron deficiency, it can affect both men and female type of hair loss, right?
Yeah, absolutely. You can have iron deficiency as a woman and as a man, of course. Could be due to underlying conditions or could be dietary deficiencies. In females, perhaps more common in patients with heavier periods, for example. So, and this is something that we can easily replace for you. And for vitamin D deficiencies, I mean, in UK, most of us, especially throughout the winter, has a low vitamin D. So that, again, is a really useful test to do.
Good. Well, going back to the iron deficiency, Claire, with the iron deficiency, let's say if someone is iron deficiency, could they how would that look like? And does it look like they're thinning hair, or are they receding, or is that a different pattern with the iron deficiency?
Yeah, so with vitamin deficiencies of iron deficiency, there will be less of that typical pattern where you can see with androgenic alopecia. It will be more of a generalized thinning of the hair. And there may be other indications such as other symptoms such as tiredness perhaps, or feeling a bit breathless that can give us a clue perhaps on whether they have iron deficiency. So for us as a GP, it's really important to look at the person as a whole. We want to know what's been going on with their lives. You know, certainly in the last 6 months or so, have they had any particular stresses?
We've got a lot of patients who come in all stressful jobs and had a lot of stress in their life.
Absolutely.
So what is the stress? Is that stress causes hair loss? Yeah,
stress absolutely can cause hair loss. So there is a condition called telogen effluvium.
Okay.
Now, this particular condition, again, a very common presentation in general practice where people come in and say, oh, I see hair everywhere on the floor. I see lots of hair in the drains in the showers. I brush my hair and there's so much hair in my hairbrush, and they get very worried about that. And a lot of the reason for that is this particular condition. It's where our hair follicles, generally due to a physical or mental stress, can shift to the sort of resting phase of the hair growth cycle.
Hence it's called telogen.
The telogen phase is the resting phase.
What's the other phase? I need to reach out to physiology book. So it's the anagen phase, is the growing
phase, absolutely.
So telogen phase is the resting.
The resting phase is the phase where the hair would shed. But normally, most of our hair would be in the growth phase. So if there is any imbalance in the hair growth cycle, then we will have more hair loss. So back to this condition. So things like mental stress. And this can happen. It could be something that happened 6 months ago, and now you experience hair loss. So it's really important for us to check with the patient what's been going on in their lives. So work stress, home life stress. Even stress on the body. So if you've had any major surgery, if you had a major illness, it could lead to this. Another very common thing is childbirth. So women who's given birth and experiencing a lot of hair loss after their birth, and this is the reason why it is telogen effluvium, and also weight. So if you had a big change in your weight, so weight loss from either diet or medications, because there's weight loss medications really popular now, and that can also lead to telogen effluvium. But the good thing is, generally, you can recover from it. Yes, your hair can grow back as long as certainly that stress is resolved. So, that's something commonly we see.
And what can you do about the telogen effluvium?
Yeah. So first of all, we want to address the underlying cause if there is one that we can address. So, for example, certainly with mental stress. So, if someone is suffering from any work or life stress, we can help them with therapy, and ways of managing their stress with changes of their lifestyle. And that can all help with this. And I mean, sometimes you can also consider medications. For some men and women, that might be something that's helpful for them for that temporary phase where they are losing their hair and they find that distressing.
What type of medications for them then?
Yeah, so they can consider, for example, topical minoxidil, which is something that you can easily...
it's over the counter,
you can buy over the counter. Unfortunately, it's not... it may be available in some NHS localities, some areas. Certainly... It's not in the area that I work in. It is not a medication that would be on offer, but you can certainly get it over the counter, and it is available for men and women. So you can consider using this until perhaps your hair grows back. So this is something you could think of.
Hey, talking about this availability with the medications, with majority of my patients, we with male pattern hair loss or female considering hair transplant treatment, these medications, some of them are available on the NHS system and some of them not available. Can you tell us? Can you tell us a little bit more? Let's say just now we touched on the minoxidil. It's not available in your area. You mean some areas available?
Yeah. Okay. Yeah. So if we focus more on the treatment for androgenic alopecia, let's say. So, I mean, unfortunately, I think with the NHS, it is more considered a cosmetic issue. So therefore, it is not that readily available, although, as we both know, it can have a really big impact on someone's mental health, their self-worth, their confidence. It can affect lots of other things as well. But due to NHS budget, it's unfortunately not available. But yes, so in some areas, and you will have to check whether, for example, topical minoxidil would be available to you. Now, there are other medications, so minoxidil also comes as an oral form. Now, this is usually prescribed in secondary care, so not in primary care at the GP level. So again, this may be available in when you see a specialist on the NHS for you. Now, another medication your patients may be on is finasteride. Yes, finasteride. And now finasteride... for androgenic alopecia. Now, that is only available as a private prescription. It's not available on the NHS, so you will have to get it privately. Although other people, you may have heard of finasteride available on the NHS, but only as a higher dose and for prostate problems. So,
is that the 5 mg dose?
That's right, the 5 milligram dose, whereas for androgenic alopecia would be the 1 milligram dose. So unfortunately, not available on the NHS. Now, we did talk about other causes of hormonal imbalance that can cause this. So for some women, for example, if they do experience this due to polycystic ovarian syndrome, for example, then yes, so they may get other treatment, for example, from their secondary care from a consultant like spironolactone, which can help with their hair loss, or even as GP, we can prescribe contraceptive pills to help them balance out their hormones. And of course, for women who are perimenopause, they can consider HRT, for example, hormone replacement therapy that may also help with their hair loss.
So with those needs fairly constant monitoring, right?
So you mean these medications that we prescribe?
The spironolactone and the hormonal replacement therapy, those medication needs constant supervision? The patient needs to go back for review and things?
Yeah, with spironolactone, we would generally want to have some baseline electrolytes checked first and then sort of have them more regularly. So with hormonal replacement therapy, I mean, we would certainly have a chat with the patient first, whether it's suitable for them and making sure that is the right medication for them, and have regular reviews.
And it's interesting because a lot of modern medications is easily, if you Google them or you search online, you'll find that it's available online, but they're not actually prescribed by your own GP, and hence is number one is not recorded and in your health
Absolutely,
patient's file. But so sometimes you might need a little bit of monitoring those as well. So,
absolutely, yeah. So I think always, I said, be guided by medical professional when you start on any medication, because there could be an underlying medical problem that is causing it.
And I gotta say, sometimes I look at some patients of mine who come to see me, and once in, I think, while majority of the patient or significant part of the patient are fairly straightforward. Let's say with family history receding, been going on for years, no other symptoms. But they are sometimes at one or two that will indicate is not so straightforward, and some of them is just so difficult to for a non-trained pair of eyes or non-trained person to identify. So it's actually quite important to get the diagnosis.
Absolutely,
right.
And it could be to do with the skin as well. Your skin on your scalp. Sometimes we see skin conditions such as inflammatory conditions like seborrheic dermatitis, which can lead to hair loss, psoriasis of the scalp that can lead to hair loss, and all of that. You need to manage.
I do see one or two female immune conditions such as frontal fibrosing alopecia, or this is more dermatological diagnosis or management area. But sometimes patients do get confused. I think I'm losing hair because of age, but actually it might be other conditions.
You mentioned alopecia areata, very commonly seen in general practice as well.
Alopecia areata is that patch?
Yeah, so it's a very typical presentation. People come in and they have a very clear patch of hair loss on their scalp or even their beard, anywhere where you can have hair, really. And it could be a single patch, it could be multiple patches on your hair, on your head, and it could even be your whole scalp where you can get something called alopecia totalis. And in my experience, it's a very distressing condition for patients because it's very obvious. Usually you can't hide it as well because it's not a general thinning, it's a very specific area. And I would say it is distressing because in general practice there are some topical medication we can give them, but it's not a quick fix. And even if you refer to dermatology, as you know, under the NHS, it could be a very long wait. And during that time, they can have more patches come up, or that single patch can grow larger. So, and then they're very stressed about the situation, which can lead to more hair loss. So it is a very distressing condition for people. And therefore, I think it is important to seek help early. In these cases, sure.
I do have one or two requests on the alopecia areata, but of course, because it's such a often the hair in that patch grows back.
Absolutely.
So there's no real indication for a transplant if it is straightforward. But I do see one or two long term. It can remain long term.
It can, yeah. I mean, luckily for most people, your hair can grow back. But you don't know when. you don't always know the time scale of when it grows back. And I think that is a very distressing thought for a lot of people. But so for most people, it will grow back. So it may not be... but there are other treatments that is available that you can try.
What are these treatments available, doctor?
So in general practice, as a GP, we can prescribe topical steroids. So topical steroids cream that can be helpful in this situation. And specialist dermatologists, they can also consider injections, so steroid injections directly into the patch of hair loss to stimulate hair growth. And in some cases, they can even prescribe some biologics medications for this problem, because it is an autoimmune condition where your body decides to produce antibodies to attack your own hair follicles and cause you to lose hair. So there are treatment available, but it is sometimes it is a matter of time, for your hair to grow back. So
Okay.
Yeah.
Cool. So, what do you see most common in general practice with different sort of hair loss? Which are the most common ones?
Yeah. So I think the commonest is still androgenic alopecia, and then we'll see sometimes to do with the telogen effluvium because of just life stresses, and then we will see hair loss that may be contributed by deficiencies, and then less commonly perhaps we will see it due to other conditions, autoimmune conditions like lupus, for example, or other inflammatory conditions. And I won't go into too deeply into those here, but they will then need a specialist referral and be diagnosed via a skin biopsy of the scalp. I certainly do know a patient of mine who that's how her lupus was diagnosed from hair loss and from a scalp skin biopsy that this was found out. So we see all sorts of reasons for hair loss. So that's why it's so important for someone, if you're experiencing hair loss and you're worried about it, to see a GP, see a doctor to find out what the cause is for you. Yeah.
Cool. Do you get patients who come in and ask for hair transplant?
Yeah, I mean, it's certainly an option that I can tell people about. Yeah. Absolutely. And if it is something that is obviously impacting on their lives a lot, and the treatments they've had so far certainly are not effective for them, and it's always really helpful to give patients different options that is available out there. You know, and hair transplant is certainly one of them. And I think as GPs, and it's great that we're here, that I know a lot more now about hair transplant. And
okay, tell me about hair transplant.
Mark, I think you're much more suitable for that. But certainly the techniques that are used, a few techniques that you use, for example, it's not something that's me or we are taught in medical school. So certainly knowing what kind of treatments are available is so helpful for us to give patients, and I believe people should have be given informed decisions and options all available for them to choose. So I think it is very helpful, and we certainly may see patients who've had hair transplants for any follow up for other conditions or about their scalp. So. Yeah.
So if someone is coming in, and what is kind of your, let's say, some prospective patients who come in and say, Doc, I think I'm receding or losing hair. So what are your sort of sequence of things for them?
Yeah. So if someone comes to me and their main concern is that they feel their hairline is receding, I will go back to basics first of all and take a really good history and examination, and to perhaps do some baseline blood test, have a look, certainly examine them to see if it's the very typical pattern of that receding hairline, or around the temporal areas, and in women more around the side, so the middle parting, the thinning of the middle parting, which you get from androgenic alopecia. Now, if everything comes back normal and we know, well, this is the most likely diagnosis, then I will have a frank chat with them to, first of all, I want to know how big an impact it is having on them. Is it affecting them psychologically, certainly, and how much help they would like to get for this problem?
I think for guys, a lot of them don't tend to talk too much. They try to do they block them out and think this is just a hair problem. I'm okay with that. It's not many places that they can talk about that, right?
Yeah, I think perhaps because in the NHS there's not a lot available for them, perhaps, so they may put up with it or they may just accept it. But as we both know, it can be such a huge impact on people. So I think when it comes to that, then it should be considered as a problem and be offered different treatments that are available to them. So I would talk to them about we talked about minoxidil, finasteride, which we can, available on a private prescription. And then, of course, all the other options that are available, such as hair transplant and other things that I've learned more recently, like SMP.
Thanks for tuning
from a previous
to the podcast.
excellent podcast episodes. And things like PRP, so I think as a GP, it's great for us to know about all these treatments that we can inform our patients. And of course, we want to optimize their physical health, their mental well-being, which can also, of course, contribute to their hair.
Do you see your patients mostly online or in person, Claire?
Yeah, both. Yeah. And I feel there is value in both, absolutely, even online. Yeah. If someone come to me with concerns about hair loss, because there is a lot of history I would like to tell. I want to know a lot about that person. I want to know what's been going on in their lives in the last 6 months. Then on sort of a private practice, I'm able to give the patient the time available, whereas in NHS we have that 10 minutes, and it's more limited as to what we can ask them. So online, I can still offer a lot by finding out a lot more about the patients. I can guide them what tests they may need, and of course any prescriptions then we can prescribe. As finasteride is only available privately, that is something that I can do, and any other prescriptions for women, for example, that can also be available.
Do you find that you have more female patients or male patients when it in your setup? Do you see more guys or more ladies? Or?
Yeah. So I think in general practice, I do see a lot of women actually who do come concerns about hair loss. Maybe because we do experience some hormonal imbalances, more likely to experience deficiencies like iron deficiencies and the telogen effluvium because of just, again, hormonal imbalances. We do see a lot of women. But we do see men as well, and I have seen, I've had male patients who worry about their hair, worry about their hair loss, from all sorts of reasons. Yeah,
cool. So. Actually, my practice, I see mostly male, and I guess because mine is more specialized in just looking for a transplant. I do see one or two. Female patients, but majority of them are male patients, and I guess the diagnosis can be a little bit different, right?
Yes, but I think certainly because there will be female patients who will experience androgenic alopecia where topical treatments and other oral treatments has not been effective for them. And I think perhaps hair transplant is also an option for some ladies.
I think the androgenic alopecia in male and female exhibit very differently. With male androgenic alopecia, they tend to have receding or hair loss, quite a distinctive hair loss. Whereas in the back of the side, with male pattern hair loss or androgenic alopecia, you find that they still have thick hair in the back and the side. And that contrast, and that's kind of the typical look. But when it comes to female androgenic alopecia, then you don't tend to see so much of a receding or bald patch or hair on top is gone. You see a lot of thinning,
especially in the middle parting. But still can be very distressing for a lot of people. And I think in my experience, a lot of women and men perhaps with the problem with hair loss, they may have searched and they've had lots of blood tests, they all come back completely normal, and they may have been told that actually there's not much you can do about it. And they will have, they feel like that's the end of the road, they will just have to put up with it. And but the truth is there's lots that can be done. Certainly some on the NHS and in the private sector as well. So that's why I think it's really important as GPs to know what is out there, what is available, that we can advise these patients.
Also important for patients to
Yeah.
Reach out to their GP, their
Absolutely.
own NHS GP or private GP to discuss the issue, because
Yeah.
often we have this conception, I've got, I don't know, like a chest infection or something, I need to go and see my GP.
Yeah.
When it comes to hair, sometimes we don't see a GP for that, right? I go and see, I don't know, somebody else, because doctor is so busy and so difficult to get an appointment in the NHS system.
Yeah, you're absolutely right. And especially when it can present, it could be an initial presentation for other medical condition. And mental health presentations, even, people can lose hair by just pulling their hair. There are conditions where people pull their hair because of stress, and that is the reason why they're losing their hair. And of course, then we can treat the cause, we can help them mentally for that. So, so I would say definitely go and speak to a medical professional if you have any concerns at all.
Cool. So do patients come to see you after they had a transplant, or they have issues with the transplant? Have you come? Do you have patients that come to you after a transplant?
Yeah, I think if people are experiencing any problems, they can, I would say initially, certainly contact your hair transplant doctor to see if they can help there. But also, as a more holistic view, I think absolutely they can come to us to look at definitely looking after their well-being, their physical and their mental health, because that can all contribute to their healthiness of their skin, their scalp, to look after your scalp and your, after a hair transplant surgery, isn't it? So so I personally have not seen a lot of patients, but I think we welcome people if they have any worries at all. And of course, we can examine the skin, anything to, help with skin infection, inflammation after a hair transplant. That is something we can also help with.
Especially nowadays, it's so popular with overseas treatment, not just in hair transplant, in other type of surgery. Sometimes it's difficult to get back in touch with that particular clinic, and they need to be seen. And but you also offer online service that the people can connect via app or.
You can connect via my website, and also we have, of course, although it's not a in-person appointment, a lot of skin problems I can see via good quality photos nowadays, and we can tell a lot from photos. So that is also something that, of course, I can help with.
Cool. Well, if any one of you needs a little bit of advice, you can contact Dr. Clare Tong on what's your website address? www.
So it's drclaretong.co.uk.
And Claire, thank you so much. It's been a pleasure to have you in here, and we learned a lot about how GP can help with patients considering hair loss treatment and before after the transplant. So thank you again.
Thank you very much, Mark.
Thanks.